solutions, that we need to build something for the long term. And with the long term needs long-term support. So on behalf of the Health Policy Commission, I'm so energized and excited to be here. I'm optimistic that we can do this, and I'm excited to engage with you in the future. Thank you.
Thank you, Mr. Seltz. Here's the microphone. My name is Jeremy Burton. I'm the Executive Director of Jewish Community Relations Council, which is a proud member organization of GBIO. We've heard a lot of important information tonight, maybe even more than we can take in, from those who provide health care and those who manage the paying for it. We've heard from those who are working in the partnership of public and private sectors to control the costs of health care. I know it's a lot to take in and to evaluate. We heard progress, and we heard about the challenges and the work ahead. We've also heard the stories that compel us to be here and to keep being here. And we've been hearing these stories for 9 years, if not more. In 2004, when our neighbors and our families were crying out for access to affordable health care, someone needed to take up the banner and work to bring change to our Commonwealth. And we, GBIO, responded, we are here. In 2006, when it looked as if healthcare reform was going down the tubes on Beacon Hill, we, GBIO, said, oh no,
we are here.
And after we passed that reform, and the cost of providing that care was identified as an obstacle that required more action, more change, in 2010, we, GBIO, said,
we are here.
And when we passed cost containment last year, creating a new partnership with CHIA and the Health Policy Commission, we saw we were not done, that we needed to keep researching, to keep watching, to keep holding providers accountable. And we, GBIO, said,
we are here.
This is why we are here tonight. You heard that we made the commitment to do this a year ago. This is why we keep the stories of our members, who are striving to meet the healthcare needs of our families and our businesses front and center. This is why we invited our guests here tonight. We are deeply grateful to them for coming here and to show us the progress that they have made. And what we have heard is that we are not yet done. There's more to do. We've got to keep listening. We've got to keep researching, to keep asking the tough questions, and to keep coming back together with them. In my tradition, which is the Jewish tradition, we are taught, the day is short, the task is great, and the reward is vast. That ours is not to complete the task, nor is it to shy away from it. Well, the task of access to affordable health care is not complete, but we haven't shied away, and we are making progress. So I'm going to ask you all to make a commitment tonight. And what is that commitment, you ask?
We will be here.
Right? We're going to come back together in 1 year from now, and we're going to find out what progress is being